following video is a walkthrough for the Savic monitor prototype, a game-changing piece of software used for lung diagnosis. When the prototype is started, a main menu is presented to the user. In order to test and diagnose a lung sound, the system must first be trained with other sound samples, so train will be selected first. As you can see, we have a number of sound samples already loaded into the software. The more samples available, the more accurate the system will be, so the product becomes better over time. In order to train sounds, the user selects from the list on the left side and they are transferred to the right. This particular test is testing for pneumonia, so that sound as well as a few other samples will be trained in the system. While this particular test is for pneumonia, the algorithms used in the system allow it to correctly diagnose a vast number of different respiratory diseases, from asthma to cystic fibrosis and beyond. This allows the system to have great longevity and also be used in many different medical cases. Once the desired sounds are loaded to be trained, the user clicks the Pre-Process button. This gets the sound files ready to be trained by the system. Once finished, the user clicks the Train System button. Once the Train System button is pressed, the user is prompted to enter the number of neurons and the number of epochs used by the neural net training system. This is something that would only be present in the prototype, and in the final version this would all be handled automatically behind the scenes, making the system much more streamlined and easy to use for the user. Once the required numbers are entered, the neural network training screen is shown. Again, in the final version of the software, a lot of these more complicated numbers and statistics would be hidden from the user and only the required important information would be displayed. On a typical laptop computer, the training process can take 3 to 4 minutes. For the purpose of this demonstration, the process has been sped up considerably. Once the training is completed, the main menu is shown again. This time, the user will choose Test in order to test the system. On the test screen, the user will choose the sounds he or she wishes to test against the sounds that were just trained in the system. Since this is a test for pneumonia, the sound samples for pneumonia have been selected from the list on the right. Once the sound samples are selected, the user clicks the Pre-Process button to ready the system, and then clicks the Test Selected Sounds button to test the sounds. Once the user selects to test the selected sounds, it can take up to 4 minutes for results to be displayed on an average laptop computer. Given a faster computer, this process would be sped up considerably. One important thing to note about the test sound selection process is that in the final version of the program, this sound information would come directly from the patient via digital stethoscope, directly into the computer, with no manual entry required. Once the testing process is completed, the results are displayed for the user. Currently, the results are displayed in text and graphical form. The results displayed is a % correlation between the test sound and the sounds trained in the system. For the sound we tested, which was lobar pneumonia, we found a 90% correlation with the trained pneumonia sounds in the system, and a 10% correlation with late inspiratory crackles, which can also be a symptom of pneumonia. Since this test was performed with a small number of pneumonia sound samples trained in the system, it is easy to see that with more sound samples, such tests would become even more accurate over time. This concludes the walkthrough demonstration video of the Savic Monitor prototype software. Thank you for your time, and we hope this sneak peek at the game-changing Savic Monitor software has been both helpful and informative.